You take your blood pressure medication every single morning. You follow your doctor's instructions. You're doing everything right. And yet, your body feels more tired than it did a year ago. Walking up a short flight of stairs leaves you winded. Your energy fades halfway through the day. And there's this quiet, frustrating thought in the back of your mind. Why do I feel like I'm getting weaker even though I'm taking care of myself? Here's something most people are never told. The problem may not be your age. It may not even be your lifestyle. It could be the very medication you've been trusting to protect your health. My name is Dr. Javier Morales, and I focus on helping adults over 60 navigate their health using the most up-to-date, evidence-based information available today. Because here's the truth, medicine evolves. What was considered the best treatment 10 or 20 years ago is not always the best option anymore. And when it comes to blood pressure medication, that shift is bigger than most people realize. In today's video, I'm going to walk you through something that could completely change the way you think about your current treatment. We'll break down what certain common medications actually do inside your body, what newer research has discovered, and why some options that were once considered standard may now be holding you back. More importantly, I'll show you what questions you should be asking your doctor so you can make sure your treatment is helping you move forward, not slowly pulling you in the opposite direction, because you deserve more than just acceptable numbers on a chart. You deserve to feel strong, capable, and fully in control of your health again. So let's take a closer look at what's really going on. Now, before we go any further, let's understand what these medications actually do inside your body, because this is where everything starts to make sense. Beta blockers have been around for decades. For a long time, they were considered one of the most reliable ways to treat high blood pressure. And on the surface, their mechanism is simple. Your heart has what we call receptors. Think of them like tiny locks. Adrenaline, the hormone that increases your heart rate, and blood pressure acts like a key. When adrenaline fits into those locks, your heart beats faster and stronger. Beta blockers step in and block those locks, so the adrenaline can't get in. As a result, your heart slows down, the force of each beat is reduced, and your blood pressure comes down. On paper, that sounds like exactly what we want. And in certain situations, it absolutely is. If someone has had a heart attack, is dealing with heart failure, or has dangerous heart rhythm issues, beta blockers can be life-saving. In those cases, they are still one of the best tools we have. But here's where things start to shift. When we look specifically at older adults whose only issue is high blood pressure, not heart disease, not arrhythmia, the story changes. A major turning point came from a large clinical study known as the Ascot trial. This study followed over 19,000 patients with hypertension and compared two treatment approaches. One group was given a beta blocker combined with a diuretic. The other group received a calcium channel blocker along with a different class of medication that supports blood vessel health. The results were so clear that the study was actually stopped early. Patients taking the beta blocker combination had higher rates of stroke, more heart attacks, and a greater chance of developing diabetes. Meanwhile, the other group saw 23% fewer major cardiovascular events. That is not a small difference. Following this and several supporting studies, treatment guidelines in countries like the United Kingdom began to change. Beta blockers were no longer recommended as the first choice for managing uncomplicated high blood pressure. But here's the part that matters most to you. Even though the science has moved forward, many people are still taking these medications today simply because they were prescribed years ago and no one has taken the time to reassess. And that gap between old habits and new evidence is where problems begin. Now let's talk about what this actually feels like in real life, because this is the part most people don't connect to their medication. The first issue is something many people brush off as just getting older. It's fatigue, but not the normal kind. This is a deeper, persistent lack of energy that doesn't quite make sense. When your heart rate is artificially limited by a beta blocker, your body loses its ability to respond to physical demand. Even light activity, walking, climbing stairs, carrying groceries starts to feel harder than it should. For a younger person, this might go unnoticed. But for someone in their 60s or 70s, it can be the difference between staying active and slowly withdrawing from movement altogether. You may find yourself getting winded faster, your legs feel heavier, activities you once enjoyed start to feel like effort instead of freedom. And here's the hidden consequence. Physical activity is one of the most powerful tools for naturally controlling blood pressure. So when your medication makes movement harder, it can quietly trap you in a cycle, less movement, less energy, and over time, worse overall health. The second issue is something happening beneath the surface, your metabolism. Beta blockers have been shown to increase insulin resistance. That means your body has a harder time managing blood sugar. At the same time, they can raise triglycerides and lower your good cholesterol. Over time, this creates the perfect environment for developing type 2 diabetes. And this isn't just theory. Large analyses have shown that people on beta blockers have a significantly higher risk of developing diabetes compared to those on other blood pressure medications. So even if your blood pressure numbers look controlled, your metabolic health may be quietly moving in the wrong direction. The third issue is one that doesn't get nearly enough attention, but it may be the most dangerous, especially for older adults. It's the risk of sudden drops in blood pressure when you stand up. You might have felt this before that brief moment of dizziness when you rise from a chair or get out of bed. It passes quickly, so it's easy to ignore. But in your 70s, that moment can be the difference between staying steady and falling. And the fall at that age is not a small event. It can lead to fractures, loss of independence, and in many cases, a long recovery that changes your quality of life permanently. So when you put all of this together, the fatigue, the metabolic strain, and the increased fall risk, you start to see a bigger picture. This isn't just about lowering a number on a blood pressure cuff. It's about how your entire body is functioning day to day. Let me show you what this can look like in a real person. Richard Thompson was 72 years old when he first noticed something wasn't right. He had always been relatively active. Nothing extreme, just simple things like walking around his neighborhood in the evenings, doing light yard work, and staying engaged with his daily routine. But over the course of a couple of years, that began to change. He started feeling tired more often. At first it was subtle. He would skip a walk here and there. Then it became more consistent. Walking the same route he had done for years suddenly felt more difficult. He found himself needing to stop and catch his breath. His energy levels dropped. By the middle of the day, he felt like he was running on half a tank. His legs felt heavier. Motivation faded. Then came the weight gain. Without changing his diet, he put on over 10 pounds. At his next checkup, his blood sugar had started creeping into the pre-diabetic range. What was he told? That's just part of getting older. But when his medication was reviewed more closely, a different picture started to emerge. Now here's the important part. This is not about removing treatment. It's about choosing the right one. For many older adults with uncomplicated high blood pressure, there are other options that the research now supports more strongly. One of the most commonly used alternatives is a class of medications called calcium channel blockers. These work differently. Instead of limiting your heart's ability to respond, they help relax and widen your blood vessels, allowing blood to flow more easily. This reduces blood pressure without placing the same restrictions on your heart rate or physical capacity. Another strong option includes ACE inhibitors and ARBs. These medications support the health of your blood vessels and have been shown to provide additional protective benefits, especially for people managing blood sugar or kidney health. They also tend to have a more favorable profile when it comes to long-term metabolic effects. The key difference is this. These alternatives are not just focused on lowering your blood pressure number. They are designed to support your overall health, how you feel, how your body functions, and how well you can stay active in your daily life. And for someone like Richard, that difference can be life-changing. Now let's look at what can happen when the right changes are made. Margaret Collins was 75 years old when her doctor decided to take a closer look at her long-standing blood pressure treatment. Like many people, she had been on the same medication for years without ever questioning it. Her blood pressure readings were considered acceptable, but she didn't feel well. She often described her days as heavy and slow. Simple activities felt like effort. Her energy was inconsistent, and over time she had gained weight despite not changing how she ate. Her fasting blood sugar was also beginning to rise, inching closer to a level that concerned her. Instead of dismissing these changes as aging, her doctor decided to review her full health picture. Together, they made a gradual transition away from her previous medication. This was done carefully over several weeks with close monitoring to make sure her body adjusted safely. She was started on a combination that better aligned with current evidence, and within a few months, the changes were noticeable. Her energy began to return. She found herself moving more without forcing it. The weight she had gained slowly started to come off without any strict diet or extreme effort. Her blood sugar levels improved, and perhaps most importantly, she felt like herself again, not a younger version of herself, just a stronger, clearer, more capable version of who she already was. Now, if you're listening to this and thinking, that sounds like me, here's exactly what you should do next. First, take a moment to look at your current medication. Specifically ask yourself, are you taking a beta blocker primarily for blood pressure, or was it prescribed for another heart-related condition? Second, prepare 3 simple but powerful questions for your next doctor's visit. Ask whether your current medication still reflects the most up-to-date treatment guidelines. Ask if your blood sugar and lipid levels have been evaluated recently, and ask whether there are alternative options that might better support your overall health. Third, request a proper medication review. If you've been on the same prescription for several years without reassessment, it is completely reasonable to revisit that decision. Medicine evolves, and your treatment should evolve with it. Fourth, and this is critical, never stop your medication on your own. Any changes should be done gradually and under medical supervision to avoid sudden shifts in heart rate or blood pressure. And finally, start paying attention to how you actually feel each day. Track your energy. Notice your ability to move. Pay attention to patterns in your body, because those signals matter just as much as the numbers on a chart. When you combine your personal experience with informed questions, you become an active part of your care, not just a passive recipient of it. Let's bring this all together. If there's one thing I want you to take away from today, it's this: just because a medication has been part of your routine for years does not automatically mean it's still the best choice for you today. Your body changes, medical research evolves, and the treatment that once made sense may no longer align with what your body actually needs now. Now, I want to share something with you, not just as a doctor, but as someone who has seen this pattern again and again in real people. In my experience, many older adults are doing everything right. They follow instructions, they take their medications consistently, but no one pauses to ask a simple question: is this still the best option for me today? And that question can change everything, because the goal is not just to manage a number. The goal is to help you feel better, move better, and live with more energy and independence. At the same time, I want to be very clear about something. This video is not telling you to stop your medication or make any changes on your own. Every situation is different. Your medical history, your conditions, and your risks all matter. Any adjustment to your treatment should always be done with your doctor carefully and gradually. What I'm giving you here is awareness, the right questions, and the confidence to have a more informed conversation about your health, because you deserve care that reflects where you are today, not where medical practice was 20 years ago. So if something in this video resonated with you, don't ignore it. Take this information with you to your next appointment. Start the conversation. Ask the questions. That one discussion could be the turning point that changes how you feel over the next 5, 10, even 15 years. And if you found this helpful, I'd really like to hear from you. Let me know in the comments what medication you're currently taking, or simply write "reviewing mine" if you're planning to bring this up with your doctor. I read every comment, and your experience may help someone else realize they're not alone. Also consider sharing this video with a friend or a family member who might be going through the same thing but hasn't connected the dots yet, because sometimes the right information at the right time can truly change a life. And if you haven't subscribed yet, make sure you do. In the next video, we're going to uncover a hidden mineral deficiency that can make blood pressure medications far less effective, and it's something most people are never tested for. Until then, take care of yourself, stay informed, and I'll see you in the next video.